Let me introduce our last speaker for this session, Dr. Ilise Feitshans. She's a doctor in the law of nanotechnology. Today she serves as a fellow in the International Law of Nanotechnology. She's also a legal expert for the Council of Europe and rapporteur on nanotechnology. So she's going to talk about nanotechnology law for commercialization of nano-enabled products.
Can you hear me? Elise, you're just the last barrier between us and lunch.
I know, and as a Jewish mother, I have to let you eat. So I will be very careful. Can you guys hear me? Okay, and excuse me, but which one advances the slide?
I have no idea.
This guy? Okay, so in the nature of full disclosure, potential conflict of interest, I have potential conflict of interest. Everything I say to you is in a textbook that I wrote called Global Health Impacts of Nanotechnology Law, which you could buy, but you are also welcome, this is why it's potential, you are welcome to write to me at Forecasting Nano Law, like the weather forecasting, Forecasting Nano Law at Gmail, and I will gladly give you a free PDF. So maybe it's not as much conflict as that. And these are some of the what I'm talking about today, however, is found in a new paper, which I did give your staff to make available on the website if you wish, that deals just with commercialization rather than some of the big questions around that. Because what I really want to do is have the scientific community really think about building a bridge. Think of this as the ribbon around all the previous speakers. Some people touched on things that are actually hot button issues in the regulatory world, not of cells, but of writing rules about nanotechnology. And other people talked about things that, if you tried to put them into a regulatory framework, would create a whole new set of problems. And what I want everyone in this room to be thinking about very proactively is whatever you're working on, how would you put that inside a legal framework? And why is this not moving? How do I do this? There we go. So as a lawyer, my obligation to you, I work in Europe. I am in a program that's funded by CERN and the University of Grenoble. This year I'm an invited professor of all things in geology, because I advise them on raw materials in nanotechnology. But in fact, the background of my learning is I'm a lawyer by birth. My father and my children are lawyers. But in fact, as a lawyer, I must tell you my working assumption. And my working assumption, my perspective here, is that nanotechnology is a revolution in science and matter. Bulk is different than the nanoparticles, and therefore for commerce, because we're going to do some things differently, but it's a revolution for public health, and that's where nanomedicine comes in. So there are really just 2 or 3 things I want to do before lunch. One is to tell you where the law is now. There's a common myth that I want to bust, and the myth buster here is people think there's no law of nanotechnology, and that is not true, but it's a kind of legal, it depends. There are lots of things where nanotechnology is impacted by pre-existing law, and there are people out there writing laws about nanotechnology. So then I want to talk a little bit about where the law is going when the law is talking specifically about nanotechnology in this context that the French government calls bridging lab to market. In other words, when you start out on the commercial endeavor, when you're designing the nanomaterial, are you thinking about ecotoxicity and nanotoxicity in the life cycle of that when it goes to waste disposal and such? And then third of all, what can you do, because you're the scientists, you're the people that are really making this happen. So first of all, from the point of view of the law, it's nice to know what you're talking about. Every time there's a law written, there is a section called definitions. And sometimes it defines things that you would really think are, you knew that already. And sometimes the law doesn't even define what it's talking about. We see this in disability law. We see this in the USA Occupational Safety and Health Act, which neither defines safety nor health. And occupation is a sort of reference through discussion in other agencies. So for nanotechnology, there's a nice technical challenge. Does the nature of engineered nanostructured materials and devices present new safety and health risks? And risk management is extraordinarily important in nanotechnology. Danger is not the criterion. Why? Because we have unquantified risk. We're dealing with new, cool, exciting stuff where people and science have never gone before, so we don't know what we're doing. We can't give the public the same assurances we could with products that are known and tested. But from a legislative or policy point of view, the question is how can the benefits of nanotechnology be realized while avoiding the risks? And nano, because we did have a short discussion of definitions in yours, maybe everybody in this room is going to say, well, yeah, that's 100 nanometers or less on one or more dimensions, and if you took one of Elise's hairs, the diameter is 100,000 nanometers. We all know what we're talking about. But in fact, this top picture is from Stockholm just a few weeks ago. There is a casino, the Nano Casino. And at the time that I started my doctorate in Switzerland, there was a freebie given out in the grocery stores called Nanomania, which is about the size of a cold capsule. And why is this so? This doesn't like me. Oh, guys, I don't like this. I'm ready to. How do I make this move? Okay. So the question is, if you're defining it for the population, for the public, it's not necessarily the consensus that everybody in this room might share. Because why? Because it's a legislative decision. It's a political opinion. And there are consequences of where you draw that line as a legislature. Maybe you do want to include the casino in your definition of nano because the public thinks it's nano. It doesn't have a little asterisk, we don't mean 100 nanometers or less. Or maybe you say the car named Nano has the potential to impact people's lives just as much as any toxicity in nanotoxicity, and therefore it's okay to include it. Or maybe you want, as a legislature, to draw a really fine line. So there's a very big legal dilemma at the bottom of all the research that's beautiful and could help humanity. We want to advance innovation and progress, but we don't want liability for unforeseen harms that we could avoid with forethought, and we don't really have the kind of definition that politics usually likes in order to know what we're doing. And I am not happy with this. Somebody help me. This is not. There we go. Okay. So 10 years ago, when I started my doctorate, the debate was, should we regulate nanotechnology? And I would talk to people about the various government publications that came out saying, we don't know what it is, it would be nice it was defined. But in fact, that has changed dramatically because now there's law all over the place. Some of it specifically mentions nanotechnology. For example, if you're getting government funding for your work, then you're probably getting something that's brokered through the NNI, that's through whether it's National Institutes of Health or the NIST program or whatever. These are things where underneath there's a law that somebody wrote and said, hey, this is how we want the future to look. In America, we did this when I was a little baby, and a president said, we're going to go to the moon. I don't know how we're doing it. And we threw money at it to do that. We had an underlying law, a permission. So in this context, by the way, because I know in this group intellectual property is always a key issue, intellectual property is decreasingly important. Intellectual property, first of all, I see as I travel around the world that we're going to have collaborations all over the world with groups from everywhere, and some are private and some are public, and they're from different countries because they're specialized in their discipline and they need the information from each other. So for intellectual property, this is a very big challenge. And then you add to that the fact that you can copy things easier than before, and the fact that there's more than one or two key intellectual property regimes. This means lawyers can make a lot of money in the short term directing intellectual property. But in the long term, something colossal and political is going to change the shape of that. The other thing is the regulations that are so important, whether it's the FDA or the European Medical Agency, are actually going to become just a sort of baseline. They give you permission to do things. But then what happens next? Once you have that right to the property and the right to use it and put it on the market, what's next? In Europe, there's NanoReg 2, which has templates for how you deal with certain things, and there are emerging nanotechnology laws. Dr. John Howard, who is unabashedly my hero in this field, he's the man who said to me, you need to study nanotechnology, Elise. Leave the UN and study it. He says these laws are here to stay. He says people may think that they're not covered in their particular entity or that it's not touching their life, but these are not going anywhere, although this slide should. Here we go. So this is a list of some of the key players that have nanotechnology laws. As I said, anyone that's funding nanotechnology research has underlying law. But in fact, there's a move, I believe, towards a global view of nanotechnology, towards a body of law that's going to be coherent from one place to another. This photograph from my hometown where I was born in New York is the UN General Assembly. I've been in this room, but not when this was happening. This is the magic moment when an idea becomes a law. People were struggling for, you could say 10 years if it was the start of the lobbying at the UN, 25 years if you start at the ADA and the lobbying for the ADA or other countries, 100 years if you're looking at the end of great wars when people put together rehabilitation laws. They were struggling for this moment when the United Nations said, we're going to adopt a convention on this subject, in this case, disability law. And then it's the birth of a whole new way of dealing with the subject. And there's infrastructure that grows up, and people implementing, and people fighting about whether or not they're covered and whether or not they have rights. And the reason that it's possible that this will happen with nanotechnology is we're starting with such a global base anyway. We're starting with a group of laws that are growing not from some person sitting in a cave designing a typewriter and bringing it and saying, wow, look, you can make letters on paper. But in fact, multinational, multidisciplinary projects. So there aren't really specific rules in the old-fashioned model from the 20th century that says too much of this and you violated the law even if you didn't hurt anybody, and too little and you're okay even if a whole bunch of people get hurt. Maybe we'll have to change the law. There aren't, and there are working groups in many international organizations with treaty power trying to come up with those rules. And they're struggling because those models don't really fit what we're doing in our research. So there are no specific standards except for a lot of recommendations. And there are really a world of nanomaterials that is unleashing beautiful, wonderful things. So where do we get information to decide if this is good or bad? How do we proceed? If we want to proceed, we want to proceed safely. Here's an example. The World Health Organization wrote guidelines. And this is for you to read another time. I'm not going to read it to you, but it's their words. And the dilemma I have when I speak about law to non-lawyers is I could tell you my opinion of the law as long as I want, but it's actually the words of the law itself that are much more important. Therefore, I have to give you those words so you know what I'm talking about. So the World Health Organization, which is a multinational treaty organization, put together guidelines through working groups across several years. I commented in 2012 on behalf of a group of NGOs, and in 2017, they released these guidelines to facilitate improvements in occupational health, all these wonderful things. What was so special about that? What's special about it is that there's several things. First of all, we don't have the traditional 20th century model under law. Here's an exposure. Here's a bunch of people that we can prove were exposed. Here's something that caused a harm that we can prove is linked in these people to that exposure, and here's the harm, give them money, make them well, fix them, give their widows and orphans some kind of relief. We do not have that model. We do not have that model because these are really multivariate in what we're looking at, and because we don't have a predictive history, and because we have an unprecedented use of material that doesn't really have a clear line of prediction, even with great computer modeling. So that's the first thing. That means that this WHO guideline, even though it's a guideline, is filling a void in the law that is preventive and predictive. For a lawyer, this is very important because it means a whole bunch of people who are really smart and knowledgeable believe that there really is a problem. And because they believe it's really a problem, that's going to change the evidence in case there is a harm. But what's very important from the point of view of law is we don't have that straight line I just described to you. And because we don't have that straight line, we can't really say, well, there were so many people hurt by this. Law doesn't usually do that. Law doesn't usually invent and conjecture and guess what will be a problem, and because of that, make a line about what's good and bad. Law is about precedent. Law is about what happened before. Even when you look across cultures and across legal systems, even in Roman times, what happened before is a key player in law, and we're writing guidelines to fill the void in the law because we think something really bad might happen. And it's a strong and clear message that this isn't harmless, but we don't know why. The other thing that's really interesting about this is that, in fact, WHO has no enforcement authority. There are no WHO inspectors. You can get a grant to work on a vaccine and have it distributed and have WHO come with an economic person to make sure that actually the vaccine arrived and actually it's being distributed. That's not the same thing as, for example, an OSHA inspector who says, well, these parts per million, this is going to cost you money because you've got to fix it. So the first thing is that WHO did something really unprecedented. Nanotechnology is changing the law. They don't really have an authority, and they did something when we don't yet know there's a problem because experts believe that there's a very strong potential for problem. That doesn't often happen in the law. And the other thing is they said, we're going to have a sunset clause. In 2022, we're going to revisit what we did. The US Congress does that a lot, very rare in international legislation. And they had a development group that listed all of its methods and how they came to these ideas, what they looked at, and what rules they followed in putting together studies. So it's a preemptory strike. There's no specific link between an exposure and harm in the traditional 20th century model of law. And there are no guarantees. They can't say that if you do this, everyone will be healthy and safe, or nobody's going to come and complain that you hurt them. There's no guarantees to it. It's a guideline. The trade-off you make when you have a guideline instead of a law is you can obey it and follow it and be good, and that doesn't mean that if something bad happens, you have an adequate defense. But you might. So one of the things they look at, remember my picture of the United Nations, is an international convention that about 100 UN agencies and about 100 countries, including the US, participate in, called the Global Harmonization of Chemical Safety, GHS. And without getting into too much detail about GHS, I'm not going to keep you from food, unless my slides don't move. What is this? Okay. It's about annual training. It's about safety data sheets that are for disclosure. It's about methods of classifying and labeling chemicals. And it's what we call in the law the right to know. GHS does not mention nanoparticles and nanotechnology. It mentions known or suspected health effects, adverse effects. And it's a template form. And if you think that there's a risk, you have an obligation under law to try and prevent those problems through training, through disclosure on forms, and through discussion and participation in meetings. And NIOSH is very much a part of this. Dr. Howard has really been a leader and really amazing in trying to make recommended exposure limits, because guess what? Just like WHO, NIOSH has no enforcement or inspection authority. I've been to meetings where people say NIOSH regulation, and it's not true. The R is not for regulation. The R in REL is for recommended exposure limit, because NIOSH does not have an enforcement authority. It cannot promulgate laws. But it's been concerned since April of 2009 about carbon nanotubes. So it means that if you go to the web and you look for the guidelines and you look for the use of titanium dioxide or nanosilver, you can find a place to begin the analysis, which is very important. So, there. So that sounds really kind of amorphous, because it is. It's a law that's in transition. It's a new technology, and instead of playing catch-up 20, 50 years later, when asbestos companies were at risk of falling apart because suddenly they discovered the exposure hurt many people, and courts and judges were angry, instead, the system is growing along with the scientific knowledge. Maybe not at the same pace, maybe it leads, maybe the law is the leader, because without the legal basis giving permission for the research, there would not be such research, and maybe it's following because it's after testing and discussion and all kinds of nice studies. But in fact, there are two systems in parallel that are relatively close in time. Again, a change in governance, and unprecedented, because previously that was not the model. You wait for the harm, and then you trace the steps back and reverse engineer and find the harm. Well, in Europe, actually, there is a completely different view of this. The two views are becoming closer because of commerce. Because if you ship in one country and you put it together in another country and you've developed it in another place, then actually the laws start working together to try and come up with an approach. But in Europe, they have something called REACH, the Registration, Evaluation, Assessment of Chemical Hazards. You actually have to register a material before you can use it in commerce. ECHA in Finland has this marvelous staff. And it's a unified system. There's enormous detail in how you use the substances, how you describe their use, their context of their use. The same material may or may not, in fact, be dangerous depending on how it's used, never mind the exposure level, which is also taken into account. And what's really fascinating is, until recently, REACH had a 1-ton limit. In other words, if you were dealing with less than a ton of a material, then in fact you didn't need to worry about REACH in 1 year. And everybody said, well, I mean, a ton of nanomaterial in a year, that's like all the drug delivery in the United States at the time that they were saying that. REACH was written in 2011. And so the joke was, REACH does not reach nanomaterials. But it will in January 2020, because the popular will said, we want a precautionary approach, even though we don't have the proof that it's the kind of danger that, say, asbestos is so notorious for. So the EU actually amended, first of all, carbon, which historically was not particularly considered dangerous. Do you ever remember carbon paper? Are you old enough to remember? What did carbon paper do? Tell the high school students. What was carbon paper? It was for copying. It was a piece of carbon that you put between two sheets of paper. And one you wrote, and the other had the carbon imprint. So that was a household thing as well as an office thing. It wasn't considered dangerous. And there, carbon is on the list of the registered materials because of carbon nanotubes. And in the European Food Safety Authority, there is a whole set of guidance, 95 pages long. I promise you I'm going to spare you that, on the nanostructures in food. Nanostructures in food means not just that there's a nanoparticle that is infused like titanium dioxide to make the donut fluffier. It's more than that. It's nanopesticides. They call it field to fork. if there is something called contact transfer, which I don't understand. There is a big chart with stepwise analysis, and you go through that. If there's contact transfer of a nanoparticle from packaging, from a countertop on a conveyor belt when the meat is being cut, then EFSA thinks they have something to say about that. And that is a very real problem. And the EU, of course, this is the building where the EU writes its laws in Brussels, a very intimidating, scary building, is a reflection of collective will and political power, but it is not the only voice for Europe. Europe speaks with one voice, twice. And this is, you're laughing because you know Europe. Switzerland is in one and not the other. Isn't that true? Okay? The European Union is, depending on where Brexit is today, I haven't looked at my watch and the deadline for the debates about Brexit, but depending on Brexit and depending on whether Switzerland is part of a particular committee or not, based on its own voluntary choice, the EU is between 26 and 28 participating countries as members on any given day. And Switzerland does have the right to choose when it wishes to participate. By contrast, the Council of Europe is 47 countries. So if you do the math, no matter how many people you include in the EU, there's an overlapping group, and then there's a group that are not considered European in one set of laws and are considered European in another. And I could easily write a treatise about that. Oh, no, I do want to help. This is the Council of Europe in Strasbourg, literally across the street from the Strasbourg offices of the EU. And they have, of course, issued reports and authorities and questions on what should they do about nanoparticles, because they are the home of the European Charter of Human Rights, which is a model that has been followed in countries around the world. And in that charter, there is a right to health. And if something is a health hazard, individuals have the right to bring a complaint against their own country. So in the USA, we have TSCA, which never particularly mentioned nanoparticles, but lists a whole bunch of criteria and is beginning to follow this REACH model of registration in advance and asking questions before something reaches the market. So where are we going on this bridge? I'm going to give you a quick glimpse of some of the things that are emerging, some that actually say nanomaterial, like EFSA, and some that are really new and don't necessarily mention it, but I don't like this. Okay, here's a new product that's really exciting, if this will work. Oh, yeah. This is a new product that's really exciting, and I want you to think through with me the thought experiment. Here is a nanosensor, and it's embedded in clothing. It's not on the person. You could view it potentially as a medical device, because here the purpose is for respiratory and heart monitoring. And at the same time, it's really just carbon nanotubes woven into a little patch on a piece of clothing that somehow magically, I don't understand how, and thankfully I don't have to know that in detail, magically transmits this information. So first of all, it's a carbon nanotube, which previously was considered harmless, but we now know is going to be covered by REACH. So is this something that's going to fall within the REACH bailiwick? And what happens at the end of the life of that product? That ridiculously cheap product compared to the price of the major equipment that's required. And will everyone have to use it? Will they all have to give informed consent in order to have it sewn into their clothing? Or are you going to buy a T-shirt or be authorized a uniform and it's going to be in there? For example, in aviation, it would be really cool to be able to know what's going on with the pilot. Are you going to require it by law that they have that kind of information? That's one dimension that a new product raises older questions of law in a very unusual context that's very fascinating. And when you ship it from the EU and it goes to another country that thinks it's European, but the EU doesn't think is European, are they covered by the European law, or is there some global realm of law that helps keep the path consistent, that brings predictability and consistency to what you're writing in your contract when you just want to send off these few pieces of fabric? Or do you want it to arrive somewhere and the guy in Brussels says, hey, you know, this is forbidden under Code 42 here. You can't bring this in. Or you can bring it in, but we're going to confiscate it. Do you want the law to just be randomly in all the different places? Or is there going to be some major overarching law that's going to facilitate this? So one of the things the Europeans are looking at, I have the honor of being the legal advisor for the European Commission to something called NanoRego. It's one of 3 EU projects. This is not going to be finished for another 40-something months, so I'm not going to give you much content here. But the idea is that there's a place to go with these questions. When you want to know what's going on with something, there's a place to ask people who are experts. In the US, we ran to the California Court of Appeals when we wanted to prevent the marketing of a product with nanosilver. And that litigation took 3 years because the judges didn't understand nanosilver, and they were really honest, and they said, we don't understand it. We want masters to come in with special information and special reports. The EPA findings were being challenged, and they had a group of people who were their approved experts, but that was all starting from scratch. An enormous downtime to lose it for 3 years. So NanoRego, the basic idea is there would be a place to bring that kind of a question. But we don't know yet the scope of jurisdiction. We don't know if they will actually just arbitrate and listen to stories or have some judging capacity to adjudicate. We don't know whether they will be writing opinions or just offering guidance. We don't know whether it would be binding and who it is that would have to be bound. And if you don't like it, is there a place to go and appeal? Can anybody bring a complaint? Could a consumer pick up a piece of paper and say, you know what, I think this is coated with nanosilver wire circuitry, even though I can't see it? Could they go to this NanoRego with either questions or complaints? We haven't decided yet. But what's fascinating is there are 3 parallel projects because the EU said, we don't want just one group telling us what to do. We want a choice. If we pick 2, it'll be polarized. So if we have 3 parallel projects, we will have choices. We will likely take pieces of each of them and synthesize them, or we may just pick one. But they understand the importance of asking these questions right now. And one of the things that is incredibly important for this group that I think we should never lose sight of is that all the work you're doing changes the meaning of health and disability. It's a paradigm shift. When I started these talks and these studies, the WHO had just put out its study, the first ever World Report on Disability, and they said disability is a social construct. It's not really about your biological medical infirmity. It's about how society responds and what it expects of you when you can't do certain things. And there are lots of really interesting examples that make great sense. But if that's true, then pre-symptomatic testing, which was offered in the original promises of nanotechnology for cancer and such, that would lead to one set of questions. Are you disabled just because the test says you should get something? Now we're talking about a cancer vaccine this morning. Are you going to be required to have that? Is there some legal penalty if you fail to accept it? Vaccine is certainly not a resolved area of law in the United States and in many other countries. And then on top of it, does that mean you're insured? Does that mean you're protected under the disability law in the pretty picture I showed you of all the countries of the world saying, you know what, we have certain protections we want for disabled people? We don't list, by the way, in that law, a list of diseases or harm. We list infirmity in the ability to do things, impaired function, and we list acts by third parties that keep the person from performing to their capacity. So we do not list diseases. So anything that would go on here, I love this picture. This is also from Stockholm. They're really ahead of us. This is just a few weeks ago. This young lady is a disability activist. She is blind and deaf, and where there should be a steering wheel, she has a guide dog. for her autonomous car. So there's a lot of questions, even just for the future of nanomedicine. And John Howard will tell you the answer to this question is no. Does the enterprise have a choice? Who would know if we didn't do it? This is complicated. This sounds expensive. This is not really our priority. There's no recent problems. Didn't stop WHO and NIOSH from writing volumes of guidelines with experts sitting there thinking very carefully about their methods and their information. Injury is going to be hard to prove. And what I predict is that we will have a new paradigm in the 21st century for how we determine harm from either an exposure or a product, because that straight line is never going to exist. For one thing, we cannot capture the data of all the exposures that have been nano-related since the use of nanotechnology really took off in the early 2000s. So what you're going to see instead is more use of the hierarchy of controls. These are the ILO documents. I had the honor of working on part of this that talk about due diligence and the steps you take to make a safe and healthful workplace, and more discussion in-house of what are the potential problems and how do we solve them, with documentation of how that works, because you need to prove that you tried to solve it. You need to prove that your steps were reasonable. And more. This is not pretty. Why is this? Okay, yes, more stepwise self-enforcement. The EFSA has a chart, and if you have answer 1, you go over here. And if you have answer 2, you go over here and do more testing. This is self-enforcing. And the reason it works is because you take that package of information and you transfer it to the next part of the story. The contract says that the patch is going to go from Japan by Brussels to the United States for use in clothing in a sports uniform. Okay? Well, each step along the way, all the GHS information, all the other regulatory information will follow as part of that training and part of that disclosure that's required under law. So if you make a mistake in your stepwise, if you're not honest with yourself, then you run the risk of having bad data. And so you have to step carefully. What difference does it make? Well, here's an opportunity. We in Archamp, funded through both CERN and the University of Grenoble, have a program, AI for Health, and we have biocomputing schools. And also, we have students coming all year round to discuss these issues. And the reason is that nanotechnology's revolution for commerce can revolutionize public health. And I hope that you will write to me and ask for free copies of my book in PDF so that I won't have a conflict of interest. Thank you.
Hi.
Hello.
Thank you for your presentation. It's an interesting topic. So I feel like the FDA has kind of taken a different approach to this than the European Medicinal Agency, where the FDA doesn't regulate nanoparticles in a stricter manner just because they're nano-sized. And one of the main reasons for that was the 2007 Nanotechnology Task Force. And Dr. Mauro Ferrari was one of the main people there that made the point that there's no reason that we should regulate nanotechnology more than small molecules. And now he's going to be the president of the European Research Council. So that's going to be interesting to see these two perspectives coming together. I'm sort of the opinion that nanotechnology is so massively broad that every type of material could be a nanoparticle, same as small molecules. You can have a water molecule or you can have a toxic compound.
Militates in favor of a definition that includes the casino.
Yeah, exactly. So
But I mean, for the mind of the public, those are political decisions. So continue, please.
Yeah, and blood, of course, is a huge nano substance. And so it would be interesting just to see how the European Medicinal Agency and the FDA come together with these sort of differing perspectives.
Well, I think there's two answers. There's now and there's the future. Now, the theory of the law, and I'm one of the few people that actually cares about the theory. Most lawyers what we're trained in law school were basically technicians. Here's a statute, make it fixed so that your client can go merrily puttering along afterwards. And what I don't like about private practice and litigation is if they come to you without doing their homework and knowing what the law says and what their rights are, but also their obligations, then you're telling a person, this is what you did wrong, pay me a lot of money per hour. And it doesn't work, okay? But at the present theoretical base, these are polar opposites. And there are even people in Europe who believe that it's actually a surrogate for a trade war, because these are ways of keeping each other out of each other's markets. Because if you follow the law in one, you are not necessarily compliant with the other. And certainly REACH is preemptory, which the US very rarely does. So it was, when it started, viewed as favoring the countries that were already registered for other stuff. Now it has matured. So on the theoretical level, these are two very different ways of attacking the same problem. However, remember what I told you about the commerce. Nobody grows their own tomatoes from their own seeds in their own land, never sells it to anybody, and makes tomato sauce with no other ingredients, which was Wickard v. Pilburn in 1938 that justified the interstate commerce clause in US commerce. Okay? The farmer said, I'm just using it for myself and my friends. Why am I regulated? And the Supreme Court of the United States said, because you impact the greater commerce. Well, this greater commerce is so globalized now that these bodies of law are touching and having to come together. And aside from calls for harmonization, we're actually seeing modifications in the actual text. And as for FDA saying, well, we don't have information, we know that in 20 years that won't be true, and in between that, somebody will have lobbied for something, which is where I want you people involved, because it has to be an informed change of the law and not just the response of the political will. The people that don't work in nanotechnology, when they ask me a question, they say, is it dangerous? And I say, compared to what? Because I studied epidemiology. But that's not the answer a politician would come up with. So you must be part of it. I saw a question here.
Oh, yeah. We have time?
They do want to eat.
We'll
I
just-
promise they eat.
Yeah, it's lunchtime. We'll prime you for later when we drink a lot of wine. But what say you that this is a lot of media hype? I mean, I think the point was just made. There's nothing specially hazardous about a particle that's submicron in size. And I suspect that, the media gets a hold of nano, politicians hear it, and there's a lot of hysteria when, where are we going to go? An antibody is sub-nano in size.
It's a fair and interesting question. First of all, it's more of a US-based question because we have this retrospective litigation approach to problems in the States that other countries don't share. There's a lot of proactive, whether or not it's enforced. Switzerland, for example, says voluntary compliance means if you know of a problem, you use the precautionary matrix. If we find out about a problem down the road, your penalties will be very high. So come up with your own solution so we don't see a problem. But the real answer here is what is hype but something that influences political will. And therefore, although it's hype in one sense, it's very real if you're voting on whether the tolls should be higher on the George Washington Bridge or we should regulate the use of nanotechnology in clothing. And therefore, the hype requires attention by this very community, because if you think the hype is wrong and misleading society, only this community can get in there and fix that. The political will respond to the demands of the constituency. But guess what? Most of you, I think, pay taxes, and most of you, I hope, are voting when you're old enough. So you have the same right to the political will as the rest of the crowd. Get in there and dispel the hype.
Thank you, Ilise. We will, definitely this is a very new and provocative talk. And you are welcome to interact with Ilise in the lunch. And we will rejoin at 2:15.
It's quite a tour de force.
You liked it?
That was good fodder for some drinks later.
Yes,
Good thing
yes.
you didn't get me wound up on that last night after some.
I had to get to